What if I told you that the biggest obstacle to your recovery may not be your disease? It may be the diagnosis itself. Every year, millions of people spend months or even years treating the wrong condition. They take medications that don't help. They undergo unnecessary procedures. They lose precious time while the real cause remains undiscovered. If you have ever felt, why am I not getting better? Why do my symptoms keep changing? Why do I feel like nobody is listening? This video could change the direction of your health journey. I am not asking you to stop your treatment. I am not asking you to distrust every doctor. I am asking you to become an informed health advocate. Someone who asks better questions, understands the diagnostic process, and works with healthcare professionals to reach the most accurate diagnosis possible. Let us explore 5 warning signs that deserve a closer look. The first warning sign is when your symptoms simply don't fit the diagnosis you have been given. Every disease has a pattern. Doctors compare your symptoms, examination findings, laboratory tests, and imaging results to these known patterns. But sometimes your symptoms don't fit neatly. Maybe you were diagnosed with migraines, but you are also experiencing unexplained weight loss and persistent fever. Perhaps you were told you have anxiety, yet you are fainting, losing muscle strength, and developing numbness. Or you have been diagnosed with arthritis, but only one unusual joint is affected, while other findings don't match. One unusual symptom doesn't necessarily mean your diagnosis is wrong. However, when multiple important symptoms don't fit the overall picture, it deserves another careful evaluation. Ask your doctor, can you explain how each of my symptoms fit this diagnosis? A good doctor should be able to walk you through their reasoning. The second warning sign is when the recommended treatment isn't producing the expected results. Not every treatment works immediately. Some medications take weeks. Some conditions naturally improve slowly. But there should be usually some measurable progress. If months pass with little or no improvement, or if you are consistently getting worse despite following the treatment correctly, it is reasonable to ask whether the original diagnosis should be reconsidered. Sometimes the medication is wrong. Sometimes the dosage needs adjustment. Sometimes the diagnosis itself needs another look. Medicine is a process of testing evidence, not defending assumptions. Your doctor should periodically reassess whether the diagnosis still best explains what's happening. Now, the third warning sign is communication. Have you ever heard, it's just stress? You are overthinking. It is all in your head. Just live with it. Sometimes stress truly contributes to physical symptoms, but stress should never become a shortcut. Explanation without appropriate evaluation. You deserve clear answers. You deserve explanations. You deserve to understand why this diagnosis was made. What evidence supports it? What alternative diagnoses were considered? That would change the diagnosis. If your questions are consistently dismissed rather than answered, seeking another qualified medical opinion is entirely appropriate. Healthcare works best when patients and doctors are partners. Fourthly, let us talk about something people rarely discuss: your intuition. No, intuition is not a medical test. It should never replace medical evidence, but you know your body better than anyone. You know what normal feels like. If somebody feels fundamentally different, if you continue deteriorating despite reassurance, if new symptoms appear that don't make sense, don't ignore that feeling. Instead of saying, I know my diagnosis is wrong, say, I still have unanswered questions. Can we review my diagnosis together? That's a constructive conversation based on curiosity rather than confrontation. The fifth warning sign is conflicting opinions without a clear explanation. Imagine seeing three doctors. One says it's an autoimmune disease, another says it's an infection, a third says it is anxiety. Now you're confused. Different opinions aren't automatically a sign that someone is incompetent. Some illness genuinely resemble another one. Early stages of diseases can be especially difficult to distinguish. However, when multiple experienced doctors strongly disagree, it may indicate that more investigation is needed. Additional blood tests, advanced imaging, specialist consultation, reviewing old records, monitoring changes over time. Sometimes the missing clue isn't a new test, it is putting all the information together in the right order. Now you have recognized one or more of these warning signs. Don't panic. Instead, take action calmly and systematically. Here is what I recommend. Keep a detailed symptom diary. Organize all your medical records in one place. Create a timeline of when symptoms began. Ask your doctor to explain the evidence supporting the diagnosis. Ask what other conditions were considered. Request copies of your laboratory reports and imaging studies. Consider a second opinion, especially if symptoms continue to worsen or remain unexplained. A second opinion is not a betrayal of your doctor, it's a part of responsible healthcare. Many excellent doctors encourage it. The goal isn't to prove your doctor wrong. The goal is to get the diagnosis right. The sooner the correct diagnosis is made, the sooner appropriate treatment can begin. Accurate diagnosis saves time, money, unnecessary medications, unnecessary procedures, and sometimes lives. Remember, doctors have expertise, patients have lived experience. The best healthcare happens when both work together. If this video helped you think differently about your health journey, subscribe for more evidence-informed content on misdiagnosis, avoiding common mistakes, understanding medical tests, and becoming a confident partner in your healthcare. Share this video with someone who's been searching for answers. And remember, don't accept confusion. Seek clarity.